My name is Eva Riedessel, and I'm going to present on the topic of forgotten grievers. Death occurs every day and is never easy to deal with, but when a grandchild death occurs, it is especially hard. There are many aspects to this death, but especially being that it's just not a natural order of how death should usually occur. Grandparents are usually the first to go, and following generations is the natural timeline of death. A grandchild death is usually considered far more difficult to cope with and to grieve over than any other death. Grandparents have almost always lost their parents, both parents, siblings, and friends, but a grandchild death has been proved to be one of the most difficult, if not the most difficult, deaths to deal with. Sometimes grandparents will feel a thing called survival guilt, and that stems from being a survivor or being someone who's still alive when you feel like you shouldn't be alive. This occurrence is happening more and more due to the increased life expectancy that is constantly increasing, and then it equals a greater chance of losing a grandchild because grandparents are growing older in age. Um, there's also a greater chance of having a harder time coping because people are having less children now, and that'll equal a decreased number of children and grandchildren. So sometimes they can be thought of as more special if they're one of 4 grandchildren versus a bunch, as in 50 years ago. This occurrence is extremely unnatural. It's non-normative because usually we don't think of children as dying, whether it be from an illness or from a car accident or a tragedy. Usually it's not a normative cause such as old age or things that happen later in life that are thought to happen. It's also off time. They're children. They're not usually thought of as dying, whereas grandparents are usually the ones who are thought of to die first. Also, another aspect to this is when there's an increased age of a grandchild, it increases the complexity of the grief, and it makes it harder to deal with because there's probably more of a relationship that the grandchild and grandparent have had. There have been numerous upon numerous studies conducted on the bereavement and the grief that parents experience when a child dies, but often grandparents are forgotten, hence the term forgotten grievers. So the research on grandparent bereavement is also very sparse. There People are often unaware that a grandparent will be grieving. They're thought of as the supporters of the parents rather than the grievers. Obviously, they're close to the family, close to the grandchild, but the focus is more on the parents of the deceased child. Grandparents are also often considered to be wise and experienced with death after experiencing the death of their parents, siblings, and friends, and so they'd be thought that they'd know how to deal with it better. Um, but there is some research on grandparent bereavement or grief, and that mostly stems from divorce research and the effects that a divorce will have on the grandparent or the family. The grandparental relationship between the grandparent and the grandchild is also something that's very unique. Sometimes grandparents can act as the caregiver, whether the parent is in jail, whether the parent dies. There's just a very unique relationship. Sometimes grandparents can be daycare caregivers or even babysitters on a weeknight or weekend night. So when grandparents act as the guardian or custodian when the parent is not available to be the guardian of the child, that also puts a different turn on grief when a grandchild does die. Whereas if they're a caregiver or a daycare provider, then it's a different feeling. And there's a unique relationship between grandparents and grandchildren. Often grandparents have the same feelings towards the child, the same amount of love, as you might call it, and they care for the child, but they don't discipline the child as much because they're not the parent. But a fact in the studies was that grandparents experience the same amount of grief as parents. The grieving process when a grandchild or any child dies is a lot different than one of a natural death that you might call a death in someone's late age. The grieving process should always start in the palliative care steps. That way it involves the child and it prepares the family and grandparents for the death of the child, whereas it's not a sudden decision on how to grieve, or it's not as hard to find ways to cope. Involving the child as much as possible in the grieving process is very important because it incorporates the wishes and the hopes of the child, and sometimes that can motivate the family to grieve better and form a better family bond. It's also important in a death of a child that you involve the child because the child usually knows what's going on. Once they reach about the age of 7 or 8, they know that death is permanent and they have a good grasp on what is happening. So involving the child may not seem like it would be beneficial, but in reality it would. In any grieving process, there's usually during the bereavement of a grandchild, there's 3 stages usually of coping, and that includes worrying about the adult children first, and the grandparents trying to act as the supporters of the children, and then after that, it comes time to dealing with the grandparents' own grief, and that would be coming to terms with the grandchild's death and grieving over that death. And after both of these grieving processes are done, there will be a return of a will to go on, and that's thought of as a healthy grieving process, or one that happens quite often. During a grandchild death, the role of different family members is often very different. Mothers are often considered the primary grievers because they're the ones who are closest to the death, and this more occurs with infant death because the mother carried the child. Fathers are often considered secondary because they're often referred to as the support person for the mother, but they also are almost a primary griever, could be considered a primary griever because of the grief they feel. Siblings are also considered secondary because they have a close relationship with the child, but it's also different than the mother or father has a relationship with the child. Grandparents often are considered to be supporters of the bereaved parents versus grieving the grandchild death. This is where the term forgotten grievers comes into place. They're often said to be forgotten grievers because they're not noticed to be primary grievers, although they sometimes or most often will have the same amount of grief as other family members will. The role that grandparents take on is often the support of the bereaved parents in many different forms. They'll often call or visit or just be available for the family to support the parents, and also providing financial support, and this can be in the form of funeral costs. Also, a thing noted in the studies was that helping an adult child cope is nearly an impossible task, and that's important to note because the grandparents are trying to focus on their own grief, but also their child, and it can be nearly impossible to get over both griefs. Grandparents are often concerned about the legitimacy of their grief because they don't feel that they should be primary grievers, or they don't feel that they should be grieving as much as the son or daughter are. But one of the most significant sources of stress during this grieving period is the unknown role that grandparents take on. They complain that there's no place or certain role that they should be taking in the mourning process, and they feel out of place and have unlegitimate grief. Another common term when discussing grandparent bereavement and forgotten grievers is the term double pain, double burden of worry, or double mourning. Any of these phrases are common. And this double pain stems from supporting their own bereaved adult child, but also supporting themselves in the grieving process over the death of their grandchild. This double burden of worry focuses on the bereaved child more often, their adult children, versus their own pain and personal mourning, and that causes a neglect of their mourning process, which can really interfere with an outcome that's efficient after a child's death, a grandchild's death. Gilrain, McGarry, and O'Grady reported the phenomenon of not only a double burden of pain, but in fact there were 5 aspects to this cumulative pain. So they associated this cumulative pain with pain that is common to all grief experiences that anyone who is going through a death would experience, pain associated with the negative changes in the son or daughter, so noticing negative effects from the grief and from the death of their child can inflict pain on the grandparents. Pain associated with the son or daughter's pain. When their son or daughter is in pain, that also reflects on the grandparents. And just the fact of losing a grandchild is an immense pain, and that factors in also in the previous bereavements that they might have experienced. The death of their parents, siblings, friends can also play into effect. The grandparent and adult-child relationship is also one that is unique, like the grandparent and grandchild relationship. The grandparents are looked at as supporters of their bereaved adult children, and this also comes into the double mourning and neglect of their own personal mourning. Pain can arise from seeing the grandchild reflected in the adult child, so seeing that adult child and the physical appearance, or even another like characteristics that are reflected in the adult child that the grandchild had, can cause pain in the grandparent. One study, Turman and Cohen reported that 51% of grandparents reported feeling closer after the death of the child and after the grieving process to their adult children, and 16% reported feeling closer to other grandchildren. This is reflected as sometimes the family can be a form of support during the process, but it's 50%, 51%, so it's just a slight bit over half of all parents reported feeling closer to their adult children. Other factors need to be taken into consideration when thinking about grandparent bereavement. The nature that the grandparent had with the grandchild before the death is a factor, because sometimes grandparents aren't close and don't have a close relationship with the grandchild, which can affect the nature of the grief. The cause of death, if it was a tragic motor vehicle accident or a fall or something that caused an immediate death of the child, that gave the grandparent no time to cope previous to the death, whereas an illness gives the time to the grandparent to say their goodbyes and to prepare for the death of the grandchild, which goes along with whether or not the death was anticipated. If the bereaved themselves are healthy or not, if they have chronic conditions already, that can really be a factor because stress and grief really have immense effects on the body. And if they had chronic conditions previously, this can propel the conditions to worse symptoms or even bring new symptoms into the picture. So there are many facilitating factors that help during the grieving process. One that was noted was sharing the grief and emotions with other people, peers, family members, spouses. Just being able to share the experiences that they were having with grief sometimes made it more relatable to other people experience the same grief, or just being able to talk about it and not having to hold it in was especially helpful. In the study by Murphy and Jones, being able to hold the stillborn infant was important because it gave them closure to the death of the infant, and being able to hold a deceased grandchild, even if they're not an infant, might be helpful, or just to see them. Acknowledging that the grandchild is in fact deceased and coming to terms with the death was important. It was one of the steps in the grieving process, and to keep going in the grieving process, that's an important step. The inclusion of the grandparents in the families and making sure that they had their roles and they were included in the grieving process, not only as supporters but as grievers also, was facilitative. And this also sometimes caused a growth of a family bond and caused the family to grow closer, and family cohesiveness really helps the grieving process. Noting positive changes in the adult child when they were getting better, also it was reflected in the grandparent as better coping. And being, although it's being a support system for your child can really take a toll on the grandparent's own bereavement process, it can still aid them as long as it's not interfering with or neglecting their own personal mourning. So being a provider of support can actually help, just to notice that you're helping the child, your adult child. But also it's extremely important to be a recipient of support also. The maintenance of the relationship with the deceased grandchild also was noted in various studies, that this included anything from sending emails to the deceased grandchild's emails to journaling or talking to the deceased grandchild. Just help to not necessarily maintain a live relationship, but it gave the grandparent a chance to cope with the death. Increased social activities was a really great facilitating factor. It helped the grandparent able to talk to other people and engage in social activities. Religion was also not only a facilitative factor, but it also could be an inhibiting factor. But for people who are really strong in their faith, prayer and religion were really helpful in facilitating the factors. Anticipating the death of a grandchild can also be facilitative because it isn't sudden. And this was reflected in the study by Hayslip and White, and it talked of Ugandan grandmothers who experienced frequent grandchild death due to the fact that AIDS is such an epidemic in Uganda. And so grandmothers would be the guardians of their grandchildren after their adult child died of AIDS, and it was often anticipated that the grandchild would also die of AIDS. And why this is such a tragic death, while it's so tragic, it also, Ugandan grandmothers handled the death extremely well because they knew that it was going to happen and they had a long time to grieve over the process. While there were many facilitating factors to the grieving process, there are also many inhibiting factors. Just like inclusion is facilitative, exclusion from the family mourning is inhibitative. The inability to acknowledge the death really kept the grandparent stuck in grief and not able to move on. If there was a collapse in the relationship with the adult child or distance, it did not help the grief. Separating, and even if the distancing was purposeful or non-purposeful, it still inhibited the grieving process. Noting negative changes inhibited, just like noticing positive changes facilitated the grieving process. So any changes in the adult child are often reflected in the grandparent. And the really major inhibiting factor was neglecting the grandparents' own self-care of their mourning. It neglected counseling that they could receive, their own health. It neglected all terms that they could have come with in the grieving process of the grandchild. The family can really act as a strong support and facilitating factor during the grieving process from all members of the family, not only the parents and siblings, but the grandparents also. It's a really efficient and cost-effective form of support. Counselors cost money, and it's sometimes hard to get an appointment, whereas family, they're a phone call away, and it's free to call, free to talk to your family members, free to be around them. The death of a grandchild can often eventually form a stronger family bond, really making those other relationships valuable and very important after the death of the grandchild. The family is looked at as the most natural form of support. They're able to comfort each other, recognize and respond to the needs of each other. They're able to encourage healthy coping and activities using open communication, and it's important to accept opinions and differing views, and that really can act as a strong form of support. Just like the family can act as a support, they also can inhibit the grieving process. Some of these characteristics of an inhibiting family would be poor communication and distancing, a lack of acceptance of differing beliefs and opinions. This can be a really strong inhibiting factor, such as the opinion on if a treatment was the correct treatment to use if a child had cancer, or the differing beliefs on religion can sometimes play an important factor. Silent anger, which really ties into the poor communication, bottling up anger, not letting your communicating the anger that you have can inhibit the process. And secrets that families might experience and they could be released during the grieving process really can inhibit, because they create unneeded drama, especially in a fragile time. There are a variety of reactions to any type of grief. Grief that deals with the death of a family member or the death of anyone includes shock, numbness, bitterness, a sense of guilt, a sense of failure, vulnerability, feeling helpless and powerless. Depression is often depression often follows the death of a family member. Sadness and unfulfillment in life, just the feeling of emptiness, can also accompany grief. Although the reactions grandparents report are not often researched that commonly to a grandchild death, the ones that have been studied include the grief experiences and reactions that many parents have. While the parents are most likely to experience more emotional reactions, both the parents and grandparents experience physical reactions. These emotional reactions also could be a limitation to the studies, just because there is not a lot of research on grandparent bereavement. Although the grandparents and parents play extremely different roles in the child's life, they really still do experience many of the same responses. Grandparents also often feel a helpless feeling, and that's from the inability to protect both the feelings and grief of the adult child, but also an inability to protect the grandchild from the death. Some common symptoms and feelings that also come with normal grief but grandparent bereavement include disbelief of the situation, helplessness, exhaustion, bitterness, somatic symptoms, pain, anxiety, and depression. PTSD was reported, increased alcohol and drug use, and thoughts of suicide, despair, and detachment from the family were often noted. Youngblood, Bruton, Blythe, Kilgore, and Yu all reported that 63% of marriages reported a worsened sex life and health, strained relationships between spouses, and also strained communication. There are many health effects, both mental and physical, of grief from the grandparents. One of them, or a few of them, noted by Ponzetti and Dufresne, was guilt, blame, anxiety, isolation, and 4% contemplated suicide. Many possible long-term effects on the mental health were aging and increased mental health issues and also comorbidities. There's also a lowered quality of life reported, decreased emotional and physical health, and the overall well-being. Their grandparents took a survey, and they reported an overall health of 7.7 out of 10 as an average. There is an increased post-traumatic stress disorder rate, grief, depression, and also a strong report of trouble focusing on the job, which is also reflected in the inability for grandparents to take a paid leave from work. There wasn't that option at almost all, if not all, employers. Increased stress-related outcomes, which come with any stress related to any type of grief, included higher rates of cancer, heart disease, mental disorders, and also a stress-related outcome was the death of the grandparent, whether it be intentional or non-intentional, within 1 to 5 years after the death of the child. Murphy and Jones studied a little bit on the differences in grandparent reactions of grandfathers or grandmothers. Grandmothers were often tending to be more likely to talk about the death and providing emotional support to the adult children. They also exhibited more emotional and physical reactions to the death than the grandfathers did, whereas the grandfathers were more likely to provide support through performing chores or tasks for the family and the adult child and offering financial assistance. They really supported in an instrumental way versus emotionally. What there was no difference noted was the feeling about the adult children and anger about the death, helplessness and vulnerability, and the feeling to make sense of the death was also noted by the study. There was also a stronger bond noted between the adult child and the grandmother. Some of the long-term effects reported on grandparents were that this death changed their entire worldview, whether it was their values, their religious beliefs, the way they perceived themselves or the way they perceived the world, their priorities in life, and their self-perception of personal power, which really stems from their feeling of vulnerability and helplessness, not being able to help with the coping of their child or the death of their grandchild. The lack of research on grandparent bereavement is also associated with the lack of resources. In Israel, in the study done by Turman, Doron, and Cohen, there was a noted no public funding for the treatment or assistance with mental illness that can ensue, or even physical illness that ensues after the death of a grandchild. And also there was no financial entitlement for grandparents. It was only for parents of the deceased child. Many of the studies were found that none of the employers had a set paid leave policy for a grandchild death, whereas many parents had a paid leave for the death of their own child. The most staggering fact that I found was of the 46% of grandparents that did experience, so almost half of all grandparents experienced mental health conditions following the death of their grandchild, only 6% received counseling for their grief and mental illness. The most important question is, what can we do as nurses? This really incorporates a bunch of aspects from the nursing field: pediatric care of the dying child, mental illness, physical illness that can ensue after stress and grief, and also palliative care, really taking care of the family and the child during the death process. Involving the child is also extremely important. As we've learned from pediatrics, children know a lot about the death that they're experiencing. They have a concrete concept of death after about age 4, and really have a permanent concept of death at about age 7. So it's really important to involve the child. It also really helps the family to cope with the death when the child's wishes and hopes are included in the grieving process. It's also really important that we remember the term forgotten grievers, and making sure grandparents don't feel like they're a forgotten griever. Really incorporating them with the parents and with the siblings in the grieving process, and making sure that grandparents are involved as much as possible. It's also important that we link family members to healthcare organizations, social, religious organizations. There's many that we can link them to. And one really important fact, as the study that showed 46% of mental illnesses, only 6% received counseling. It's important to offer the contact and possibly making appointments for these grandparents so that grief counselors can help them through the grieving process. It's really important as nurses that we work with the families and the children during the death of this grandchild.